Good morning, everyone. I'm Councillor Kimberly Barrett, Cabinet Member for Climate Change and Greening the City. Before we start, a bit of housekeeping as per normal. So if the continuous fire alarm sounds, please evacuate the room and the public gallery by the stairwells. Do not attempt to use the lifts and assemble by the statue of Queen Victoria. To comply with Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign up when leaving the building at the end of today's meeting. Most people are aware, but may I draw everyone's attention to the fact that the meeting is being webcast to allow the public to watch if they so wish to do so, and everyone speaking will be on camera. Members of press and public are permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Can I remind everyone to use the microphones and to remember to switch them off when they're finished, or the camera will remain, as per always, on your lovely faces. So perhaps we can start with introductions. I will go from Russell this way onwards.
Well, you've already announced me now by saying my name. It's Councillor Russell Simpson.
Councillor Judith Smythe, St Jude Ward.
Daniel Williams, Public Health Principal.
Jane Didino, Local Democracy Officer.
Perfect, thank you everyone. Jane, are there any apologies for today? And I understand that, well, there are no deputations today at all. No. Okay, perfect. Well, if that's the case, I will hand over straight away. Oh, sorry, declarations of interest, anybody? Any declarations at all?
Up to a point, we all have declarations of interest to make. We all breathe the air. We have no choice about it. We have much more choice about water and earth and other things. And I think that the fact we need to be able to make this personal in order to really understand the importance of this report.
Absolutely noted, Councillor Smythe, thank you. Other than that, though, no, perfect. Well, I will hand straight over to Dan to start talking us through a very important piece of work, the Clean Air Strategy 2025 to 2040, improving air quality for a green and healthy future. So over to you, Dan.
Thank you, Councillor Barrett. The portfolio holder is asked to note the final version of the Clean Air Strategy 2025 to 2040 before it goes to Cabinet for approval on the 10th of Feb. We're doing this work against a backdrop of actually improving air quality in Portsmouth, but there is more to do, and that's why we have the strategy. Recent successes include the fact that citywide monitoring shows the long-term trend for NO2 is downwards, and in terms of PM2.5, the most damaging particulate matter to the body, our percentage of that in terms of mortality is also going down, and where before it was above the England average, it's now level with the England average. Significant savings are there for us to be taking if we can improve air quality in terms of the health and social care sector. And we also have the potential to improve things economically through saved working hours, through people being less ill as a result of dropping levels of air pollution. However, there is still more to do, and our levels of fine particulate matter in the city are around about 7 micrograms per cubic metre, which is above the recommended level that the World Health Organization suggests in their guidance. And similarly, in terms of NO2, while those annual average concentrations are trending downwards, they're still above what the WHO recommend in terms of an annual average. So to develop the strategy, we took a one council approach, very much across the directorate's involvement, with representation from transport, regulatory services, planning policy, housing, neighbourhoods and building, and the executive and Portsmouth International Port. And that resulted in a new aspirational mission statement for cleaner air in the city. Everyone in Portsmouth should be able to breathe air that does not damage their health and well-being. And to achieve that, we will prevent sources of pollution, limit exposure to pollution, and protect the most vulnerable. The strategy recognises that achieving cleaner air depends on everyone's involvement in terms of trying to reduce or limit their impact on the environment. switching to sustainable practices and to active modes of travel where possible. And it also recognises that air pollution respects no boundaries. And so to improve air quality locally, we must work with our local partners and our regional partners and indeed our national partners. The approach prioritises prevention first and then limiting exposure to pollution next. And then we are looking to support the most vulnerable residents in the city in terms of pre-existing health conditions or the very young or the very old who are more susceptible to the damage that air pollution causes to the body. And so the focus will be on areas of highest pollution and sites where they live, learn and visit, so schools, care homes and healthcare sites. There's much work already going on in the city that contributes to the cleaner air agenda. The local transport plan in particular has an objective on cleaner air which supports this work, and the greening strategy and the clean air zone obviously also contribute to this, and it's a priority of course in terms of the Health and Wellbeing Board strategy. So the steering group's deliberations have resulted in 8 strategic actions, which are grouped into 5 themes. The first recognises all that ongoing work. The second one is natural infrastructure, using green infrastructure to improve air quality where we can. And then there are ones that are related to the work of housing, neighbourhoods and buildings in terms of energy efficiency and clean air heating solutions and building maintenance and ventilation. We have a focus in this strategy for the first time on indoor air quality as well as outdoor air quality, and our actions 4A and 4B focusing on this, including the harms that can be caused by domestic wood burning. And finally, in terms of the most vulnerable, we're looking to raise awareness about the harms of air pollution so people can choose to reduce their personal exposure. And we're also continuing to promote training for clinicians and healthcare professionals through our Clean Air Champions training, which is already underway. While not legally binding, striving to achieve the target set out by the World Health Organization in its global air quality guidance will motivate us to go further and faster for the benefit of residents than is currently required by the UK's national legal standards, although these were recently updated just before Christmas in the new Environmental Improvement Plan, and are asking for us to achieve targets that are closer to the World Health Organization's than previously was the case. Work is ongoing to assess and benchmark our performance in attaining the interim and final World Health Organization targets against comparator cities, and will be included in the delivery plan and subsequent annual reporting. In terms of feedback from our internal and external stakeholders, the strategy was received positively by participants. They particularly liked the inclusion of indoor air quality and the use of those World Health Organization targets, and are supportive of going further and faster in terms of reducing air pollution than doing the bare minimum required to reach legal compliance in the UK. And the broader public health approach was also well received. Following the advice we received from stakeholders, we've included case studies which do help to personalise the actions that we've included in the strategy, and hopefully they'll bring the actions to life and make them more accessible and relevant to the public. In terms of the public online consultation, 715 responses were received, and the level of support for our ambition to reach the World Health Organization targets, the mission statement, and for the strategic actions was all high. In terms of the strategic actions, disagreement was 15% or lower for all of the actions. It tended to fall into two main camps, some feeling that that air pollution isn't a significant issue in Portsmouth and believing that we should direct our resources elsewhere, while others felt we should be going further than we actually are going. So using the World Health Organization guidance, we've set interim target levels for NO2, particulate matter 2.5 and PM10, 5-year staging posts for the lifetime of the strategy, against which the progress of the strategy can be judged. We're recommending the adoption of the strategy because it will contribute to Portsmouth becoming a healthier and more sustainable and prosperous city. Partnership working is very much at the heart of the strategy. As I said, air pollution respects no boundaries, and it's only by working collaboratively, both across the council and with external partners, that we can bring about meaningful improvements in air quality. And to that end, the work of the strategy is aligned with the work that's being undertaken by the Partnership Air Quality and Active Travel Board and the Clean Air Pledge that's been developed with signatories including Councillor Barrett for the council, Portsmouth Hospitals, Hampshire and Isle of Wight Healthcare Foundation Trust, the Naval Base, the Port and Hive. And that's me done. I recommend the adoption of the strategy and putting it forward to Cabinet.
Perfect. Thank you very much for that, Dan. Firstly, great report. I'm sure colleagues will also echo, but I really hope people take the time to look through it because it's a significant piece of work. It's something that's going to be, well, this current council and hopefully onwards. It's something that will be going on until 2040. Sorry. It's, you know, so it is a really important piece of work going forward. I'm also pleased that we're setting targets, you know, for every the 5-year increments, because that means we, as Councillor Smythe, I know you said before, we really need to have proper targets going forward so that we can look to and aim towards and understand what the issues are going forwards and what we're doing to work towards that. So I'm really pleased we've set those targets going forward. I also wanted to note 2.5 as well regarding the consultation that's been done since July. I'm really pleased that we've managed to speak to so many people, but at the same time, Youth Cabinet as well. I think it's so pleased that, you know, we've spoken to so many people, but Youth Cabinet, you know, it's, as you said, there's no bounds to this. There's no, you know, this goes across everything and everyone. And the fact that we're getting local people involved, because this affects them greatly as well. And, you know, we want to encourage them to speak to their friends and sort of get them to get involved and understand what's going forward and have their input into something like this. I think is fantastic. And I know that you've obviously gone and spoken to a number of other forums which are noted in here as well. So really appreciate that work being done and the online consultation period that was run as well. Colleagues, I'm really pleased about this. I'm very happy to hand over to you if you've got any questions at all. Councillor Smythe?
Thank you very much. And I've had an opportunity to look at this at the previous meeting, for which thank you very much. I think this is a really good report, and I'm really glad that it so much focuses on outcomes for people and has some measures to do with reducing people's problems with breathing difficulties and breathing-related illnesses. And I think that theme runs right the way through this. I'm very pleased that it's about working together, and this is a whole council approach. I've always had great admiration for the public health profession, and this just cements in my mind that you're really, really good at this sort of thing. Obviously, as chair of the Health Authority, and I had a lot to do with public health, and I would have been proud as chair of the Health Authority to have signed this one off. It's really good. I think there are just two things I want to say. Well, three really. One is let's make sure we do monitor this, make sure that we do actually monitor in a public way. And maybe a few headlines in the news or in people's feeds that said, you know, another milestone has been met, and reminding people of that is really important. related to that is I do think we've got to find a way of making people read this. I mean, I don't think it's just a matter of going through it. It's a really good, solid piece of work, this. Uses evidence properly, it measures outcomes, it relates it widely to everything else we're doing as a city, including reducing traffic, reducing private car uses right in here, and we need to tackle that. Some people don't like that, but we're going to have to do things we don't like. And this is better to be reducing traffic than to all having to go to bed with bronchial diseases. And we don't like that either. So I think my main concern is how we're going to disseminate this. People are incredibly resistant to reading nowadays, and I find that, you know, total. I mean, I went on holiday for a week last week in the countryside, and we read, Terry and I read between us 12 books. I mean, well, where is the desire to read and the desire to actually learn from reading? So we've got to find some other ways of publishing this. I hope we have an absolute splash in the flagship. I want us to be really serious about it, and I want us to use every opportunity. So how are we going to get all the staff in the council to read it? I think it should go into everybody's inbox. It's easy, no cost. These are, when I was in management consultancy, I used to say these are low cost, no cost things to do. So into everybody's inboxes. Not everybody will read it, not everybody will have time, not everybody thinks it's their job, but don't let that stop us doing low cost, no cost things. The second thing is into every councillor's inbox. Absolutely, and probably more than once, probably now and in 6 months' time, because we get a lot of emails, and some of us, you just can't keep on top of every single one, but you might pick it up again. So let's say you will be sent this again in 6 months' time, and send it out. That's again low cost, no cost. I think the other thing is to do the same with people who work in the NHS. Encourage the Health Trust to put that out, because it gives them health professionals quite a clear steer as what they should be talking to people about in their surgeries as GPs and nurses and clinicians, but also in the hospital. It gives people who are interested in why they're in hospital suffering bronchial difficulties something to read, to talk about how they might help and how they might support the cause. Again, low cost, no cost. Into inboxes, a certain amount of consent there for people. And I think probably large employees as well, the university. Please send this around to all staff. Now, we're a bit reticent about doing that sometimes, and we apologise. We say it's a long paper, it's a strategy, it's a council strategy, but actually this is important for all of us. And even if we're just giving 10% of those people who receive it the opportunity to get interested, to talk to their neighbours, it's enough, in my view. We only have to think about how, in fact, smoking indoors and public smoking has been tackled by public health, and that this campaign is a natural extension of that to some extent. And we need to do that. We need not to give up in the face of the relatively few people who want to be blind, ignorant. And schools. I think some enterprising teachers could make a really good thing about putting this out in schools, either as an example of public strategy, an example of why we have caring governments and why we should have caring governments, and why what public money is being used for. So it could be used in political science and political education, but it can also be used in science education. So send it to everybody. Encourage them to send it to their parents. I think we've got to be absolutely mass on this, and if it works, we can do it with other strategies. And I'm very happy to have an informal chat, because I used to do this sort of thing as a living across the country, and we're very happy just to have further thoughts about it. I can't emphasise the importance of that. And anybody who in the public listening to this now, get hold of the report. It's online. It's easy to get. I can even send you a link, though I'm not very good at all that sort of stuff at my age. And I really say, read it. Read it from top to bottom and see how it hangs together and how it relates more widely. So that's really the main message I want to give. I think the other thing is I would like a commitment to be made by Cabinet to become part of the pressure on central government. Because a lot of the things behind this can't be dealt with without central government doing things. They've got to make it, they are actually, we are doing quite a lot of stuff on this. I'm glad to hear we put a lot of money into low carbon energy creation, more unprecedented levels have gone into that, of money into creating clean energy. We are supporting a lot of initiatives that are enabling buses to be come back into public control and be used more. So I'm not ashamed of things that the government are doing. But again, to use Daniel's phrase, we've got to get the government doing it further and faster, because some of these things can only be done by central government. So I would like to urge the Cabinet to make that decision, to be part of a pressure group on government, just to help them getting further and faster, whilst acknowledging some of the big steps that actually the Labour government have made on this particular thing. Yeah, you talked about working with surrounding authorities and so on and so forth. That's great. The last one I want to say is I think there's a genuine classic public health issue here, which is how do we help the public to make changes in their behaviour, help them to help themselves without frightening some of them silly. I mean, I know several people who wear masks because of poor air quality, and they think that doesn't do their breathing any good or doesn't help their children. I would like a bit more public guidance about what's sensible and what isn't. Because it's very easy to say, well, I'm not going to go down Fratton Road because there's too much traffic and my child is this, that and the other. We must just help people to not get too anxious about it. And I think that's really a hugely important issue. And then there'll be people who won't go into other people's... Oh, there are already people who don't go into people's houses if the people are smoking. You know, there's a kind of sense of fear around that I think we must give them help with. And I'm delighted to see the indoor air quality is spoken about. We need some more authoritative guidance for people about when to open their window and when not, and if there's a time when you're in a main road you shouldn't open the window or not, all of those sorts of things, because we know things have improved. I'll just very quickly tell the story of when I was a little girl walking to school through the centre of Birmingham in order to get to my school on the days of the great smogs. And my mum did, just at that sort of time, take the precaution of issuing us with one of my father's large, clean white hankies that she'd ironed. And you see, people don't do that anymore, do they? And then tying it around our faces. And when we got to school, you take the hanky off your face and you turn it over and look at it. And there were 3 black marks on it, one for each nostril and one for the mouth. We'd actually, those smogs were killers and did indeed in the early 50s kill a lot of people in London and in other big cities. So I think we should also keep a kind of historic perspective on this and understand that things are improving across long lives, and that we're intending this to be about improving things across generations, across long lives, rather than making people anxious about taking their kids out for some so-called fresh air and feeling too nervous to enjoy it. I hope that's a good way of putting it, and I'm very happy to be quoted on that, because this is about a long future. It's not about not going out and seeing the daffodils growing because you're frightened of just the last thing, the technology is improving. I gave there is a firm that's now creating little tiny automatic, I suppose, little tiny hoovers, that are capturing the tiny micro fibres that are coming off car tyres and stopping them going into people's lungs. Those particulates are also an important part of lung disease and so forth. And you know, that the more our children and others get interested in the higher levels of technology to improve air quality is also important. It's a career opportunity. It's something we must grab. So I hope that's helpful, and I hope people listening to this from outside have, you know, will take both some hope from that, which is really what I want to get over, because this is a great document and a great strategy, but also see this in the long term. And it's about public health, and it's never the intention of public health to make individual anxieties higher. And that's what we have to do as a public authority, is communicate that balance. I don't know if Daniel wanted to comment on that, or if I've been at all helpful, but I hope that is helpful.
Thank you,
Thank
Councillor
you.
Smythe. Yeah, we tried to make the strategy as accessible as possible. Obviously, we're hopeful that as many people as possible will read it. I think there will be some translation required in terms of how we communicate it to residents, and several of the strategic actions are around awareness and behaviour change, and we're hopeful that we'll be able to do some co-production work with residents to be able to put this across in a way that, as you say, doesn't raise anxiety but does accentuate the positive in terms of making improvements that improve people's health. The last thing we want to do is to scare people in terms of the air pollution in the city, and for them to limit their lives as a result of not wishing to encounter it. I think there are ways round air pollution, and we can advise and support with that, and that's certainly the intention coming out of the strategy phase and into the actual delivery and implementation. In terms of comms, there will be a press release around the time of the when it goes to Cabinet after it's approved, and we will do all of those kinds of dissemination that you were talking about in terms of council comms. Flagship, I hope, would certainly be a place that we'd like to see this mentioned in, and yeah, getting it into as many inboxes as we possibly can. The NHS are very supportive of this work, and there is work going on to develop not only the sort of hour-long Clean Air Champions training that we do, but also briefer advice for very busy clinicians, so that they can take on in a short time the advice that they can then disseminate to their patients in the space of a 10-minute consultation or whatever time they have. And you're right, we can learn lessons from what happened with smoking and how we tackled that. It's obviously, it used to be very much an impact on indoor air quality, and obviously less so now, which is a great thing. But there are other things within the indoor environment that we can advise people on and support them with in a low-cost sense to change, and obviously ventilation is one of those issues that you mentioned. Yeah, and so I'm very hopeful that we'll be able to communicate this in a way that does really spread the message and get people on board.
Just as a little example, when this is approved by Cabinet, and I'm sure it will be, I think, but I wondered if you, Kimberly, could send the strategy around to all the councillors with a little message saying, this is really important. You can say, it depends whether Russell agrees or not, but that I think, and suggest that all members of the Cabinet send it, make it so it's very easy for us to just click and send. And we can send it to all members of our parties. We've got a lot of, you know, that they can actually read it as well. Because we don't want to waste all these meetings having conversations with people who say, well, I don't agree. Well, the figures are there. This is an evidence-based policy, and we've got to get people learning to accept evidence and act on it. If you can do that personally, I think it would go down well. Thank you.
Thank you very much, Councillor Smythe. Just pick up a couple of points that you've said. It's like you've read my mind. On my to-do list for after, literally on the day of Cabinet, fingers crossed it is approved, I don't see why it won't be, but, you know, is to send an email to all of you. So apologies in advance, but I will be sending an email to all of you. Well, I always do, but it's a bad habit of mine. But also, I think it's really important to let you know, Dan mentioned the Clean Air Pledge. I signed that on behalf of the council last week. It was really great to have a number of our large employers who were there as well, including someone from QA and Naval Base, I think, wasn't it? And a number of other people who were there who have the same objectives as us and want to work with us. And I spoke to literally everyone there at the time before they started their next meeting. And one thing I did say to a number of them was, you know, this will be sent to you so that you can pass it around, feedback, because, you know, this is an ongoing thing that we're all working with. So I'm pleased to say that is going to be sent forward as well. I had a chat with someone in education the other day as well, because they've got their education partnership bulletin that goes out quite frequently, and we've got our climate action bulletin that goes out frequently. So I'm sure, you know, there was an interest in being able to put that in, send it out to all, so that would go to, as long as it's approved and goes on there, which I don't think it would be a problem. But the education one, that goes to education partners, head teachers all across the city, which is fantastic, and higher education as well. University, I don't think they were able to be there on the day for the Clean Air pledge. Yeah, but I don't think they weren't able to make the Clean Air.
They were still taking the pledge through their governance systems and hadn't quite got to the point of signing it off, but I think the intention is to do that, and we've provided them with further information to help that process. Perfect.
Thank you for that clarification. Yeah, but you know, we do have the opportunity to share it with, you know, anybody and everybody. It's so easy. I can make it so easy to make sure that in the email that I send to all councillors, just be a link to click on that you can forward on to anybody you fancy. There's always paperwork available. I mean, I don't want to, if possible, please read it online, because it saves on paper, and we're always good with recycling and not cutting trees down here. But there are, if people need paper versions, then that can be arranged, so that is not a problem at all. As you said, it is a really important document. And there is ongoing work. I think we discussed it when we had a chat about it beforehand, Councillor Smythe, but we're definitely looking at being aware of the anxieties that people do have around this. I think, you know, I often have to pass through, and like I said before, a very heavily used junction to get to the doctors, and with a husband who has asthma and a child who often has chest infections, I've made the choice to go a different way, a longer way, so that I don't hit that junction. So we've been doing some work, and we will continue to do some work about, and perhaps Dan, you can very briefly highlight it, sort of an option of sort of almost like a green sort of mapping exercise, so that people can decide which way they can walk, and, you know, so I don't know, Dan, if you can briefly touch on that, if that's okay.
Yeah, so we're looking at something along the lines of what Southampton have, the Southampton Air Map, which is a route planner which allows you to get from A to B using the least polluted route possible, and also potentially the least noisy. So there's another benefit there in terms of the impact on your mental well-being. That's sort of resource dependent, so we're looking at the numbers there, but we hope we'll be able to do something along those lines. And there is obviously also the work that's ongoing in terms of quiet corridors and green corridors in the city to improve them, improve access to them and awareness of them, which will contribute to that ability to get around the city without walking along the busiest routes in the city.
I'm very pleased about all that. That's great. I mean, I think sometimes, particularly with mapping out these routes or taking people on these routes, the use of volunteers is a really good thing. I think there are a lot of people who volunteer for green concerns in the city, and who, with proper degree of notice, would be very happy to take guided walks along those areas, ensure that they're litter-free. There's quite a lot of voluntary activity that could be done, and there's nothing like that for making people recognise their neighbours doing things and doing them themselves.
I agree, and I will shamelessly plug Portsmouth Friends of the Earth, who often do walks around the city, showcasing various things and highlighting things, and obviously taking on concerns and feeding back to us as a council. So I think there's definitely some work we can do there alongside whoever's interested. Councillor Simpson, I don't know if you want to say anything.
I have loads now. I didn't have as much, but I have a lot more now. Firstly, the survey. The consultation. 750 is a very round number. Was that sent specifically to people, or was that just an open consultation to anyone? And I've got another question to follow up that once you answer. No, if you could answer that first, because I think it's really important that, yeah, if you could answer that. So was that sent to specific people that you know that normally fill in these consultations, or is it open house for anyone to fill in?
So that was an open public consultation. It's just an accident that it turned out to be 715 respondents. I think there were a few that were duplicates as well, so that the actual number was 749 or something, but it reduced down to 715. You know, we promulgated it through the usual channels, Your City, Your Say, and all of the usual routes. So it stands, I think, as a representative sample of the city's residents.
I'm really interested in where demographically and also where in the city was a majority of the replies, because for me the most important thing about any consultation is reach. You're not going to get the same answers for Eastleigh and Paulsgrove compared to North End and Fratton that are a lot more urban. So I just think it's really important that if you're going to do a consultation, firstly, the reach, it needs to be far better. It needs to be across the city. I don't know how you do that, to be frankly honest. If it's just online, I don't know if you put a leaflet through the door. I don't know if, actively encourage people more. But I just feel that, for example, if you did just have the consultation, it was all in the middle of the city, where there's a very urban, you might find that it's going to be very much, people are might have a very, very different opinion if it was just all in Eastleigh and Craneswater or Portsgrove or areas that are not so close to, essentially a build-up of traffic. I just feel that we're not going to be getting a real balanced outcome if we don't have enough people having their say. That's the first thing. Have you got any data there to share with everyone?
I was just trying to bring it up quickly to give you a reflection of where the locations people were based in the city in terms of responding, and I'll have to look through the report. So if you want to say anything else, I'll have a quick look and then I'll come back to you.
Well, I think it's really important, and I can't speak for everyone else here, but I think it's really important to see who's actually filling in this this consultation and where, because it is relevant. I would almost bet that it would be a very mixed outcome. I haven't finished, Judith. I've still got to go for a few bits before you jump in there.
Later on, but just to say, I think there's a difference between, I absolutely agree with everything you said about consultation and the widest possible consultation, but I don't think we should consult on proven facts.
I'm not even doing the fact. I'm just asking a question of, what as people, what I'm trying to get at is more might be revealed based on where you are. So I think it's more about, the exposure of where you are. That's, I live literally right by the M27A3. So I'm going to get more exposure, more so. Right, second question. Would I be right in guessing that solid fuel open fire includes wood?
Correct.
So basically that's classed as very dirty and has the most outcome. Well, I'm not sure about you, but I don't normally see many people burning wood that's on the poverty line. I normally see it in other areas that are not so living in the poor areas of the city. And I think the reason I'm saying that is I think it's very good being very strongly opinionated about how you want to improve. But you also got to act on that as well. And if you're going in areas that are, I don't want to say quite well off, but areas that can afford to burn wood, I'll let you work that out for yourselves, because it's definitely a luxury, and it would be classed as a luxury, and it's expensive. So I find that very interesting. I think that's something that maybe some people could reflect on. Last but not least, I mentioned I live by the M27A3. I suffer from hay fever. Now, nitrogen dioxide makes pollutants more potent. This summer, I can't really base it on like forever, because you've got to obviously have it over 5 years, and it might just be because I'm getting older and I also have allergic rhinitis and I have non-allergic rhinitis, so I'm living the best life. But yes, this summer was a bit unusual, and it was unusual for quite a lot of people. I'm hoping next year that'll be the same, but I think until we have about 5 years of data to really see if that is a benefit. I know some things. I think even Richard Lee mentioned that it can, might have an anomaly 1 year. So let's see what it's like next year, so we can judge that properly. But I think when it comes to all of these things, it's about looking at the bigger problem. And for me, it's about having affordable public transport. So people stop having cars. Now, I don't think we live in a particularly great city for public transport because it's expensive. You've got a train line which is on the east of the city, and taxis are expensive. So if you're living on the west side of the city, you're most likely going to have a car, and if you can't afford a lovely electric car for 20 grand plus, you're going to get a petrol or diesel car. And even though First Bus is going electric, I'm hoping we will see that in the savings, but I'm not overly hopeful, mainly because I think it's in such an investment of money, they're going to want that return. And also the fact that, you know, trains are very expensive too. So I think, you know, when we talk about these things, we know it mostly revolves around cars, but the bigger problem is better public transport, but more affordable public transport. And we are, in my opinion, greatly behind compared to other cities of population size around the country. And sometimes I kind of feel if you're going to put money, real money, maybe that's actually more the better angle, improving public transport for cleaner travel than in some ways maybe spending money on things which are attacking more the working class person. And I think that's it. And I've always felt like that's been the case. You know, if you think about 50, 70 years ago, we got rid of our trams or trolley buses, which would run on electricity. And I don't know about you, Judith, but when they were digging up the roads to improve Southern, they're like, oh, we've been delayed because we've hit the old tram rail lines. I'm just like, well, why not just rip out the whole road and bring the tram lines back? Because that, you know, it works in cities in Manchester, I believe, you know, and other, you know, I just feel that we need to be looking at the public transport to really make a difference. It was absolutely obvious as soon as we got rid of our trolley buses, our trams, all run by electricity and start having cars. And don't get me wrong, like that's obviously not going to work in the countryside, and there's certain places that definitely need it, and certain people will need cars for personal reasons, disabilities, etc. But really, it'd be much better if we maybe sat down and had a look at our ambitions for local transport for Portsmouth. That's all I have to say.
I will pop across to you in a second, Dan. No, I appreciate all the points you've made there. I will say that I think, and I don't want to speak for my other colleagues on the Cabinet or the Cabinet Member for Transport, but I think especially the work that we've done in regards to the BSIP has been really good, starting to push forward that, because we recognise that we want to get people out of their cars however possible, so improving public transport, so obviously the cost is a huge thing, the frequency as well, and where they're going to, because if they're not going to where you want them to go to, or where you need to go to, then that's a problem as well. When the bus fee cap came in and the prices reduced greatly, more people went on there, which I can completely understand. I mean, I use public transport all the time. I walk. I'm just about to start cycling again, so watch out, everyone. And, you know, I use a bus frequently, and I have seen, and the figures are showing that there are more people now in Portsmouth using public transport. However, we've still got work to do on that area, so I completely take on board what was gone.
Don't mind me asking, Kimberly, because you said use the bus. Do you get like a monthly bus pass, a yearly month pass, or do you just pay on the pay as you go?
I pay as you go because I do tend to walk quite a bit as well,
Yeah.
so it just depends what's going on. And
But what's your average spend per? I'm just really curious because I think, you know, people at home are going to be able to relate with this is how much it costs me a week, and
Yeah.
you know, if you actually work it out, it probably is cheap. It is probably more expensive than having a car. Well, it all depends on the car.
see, I tend to use, if I'm going to bus it, and I know I'm going to bus it throughout the day, I personally will get the ticket, which I think is fantastic, which is the all-day ticket, which is the Portsmouth all-day ticket, which I think, oh my God, hopefully I'm not going to get it wrong. I think it's £5.20 for the day, and I can get around wherever I like across the city. Normally first bus, because Stagecoach doesn't quite, I say that because although it's outside my door, the number 13, literally the bus stop is outside my door, but I will just walk down the road and jump on the 1 or 2, because that's fantastic. It serves most of the city, especially the number 2. So yeah, I will tend to get the the all-day bus ticket. Normally I do walk quite a bit though, to be fair. It just depends on the weather and what's going on. So probably twice a week, 3 times a week I will get that kind of ticket. And sometimes I have to go outside of Portsmouth and I will use the bus then. So that is a little bit more expensive, but I will get a Hampshire ticket then, which can take me wherever I fancy around the area. So
I think that's important to mention, the fact that if you are going to be someone that's going to want to get the bus to Chichester or Brighton, that's considerably more. You know, and just I know you're saying that isn't, but I mean that's way over it. That's like 1,240, give or take. You know, people will buy a cheap car for 500 quid. So what I'm trying to say is, like, while, you know, if you're just trying to get to A to B, you know, I think this is one of the reasons why you have older cars that are technically worse, and not the new modern cars. And I think this is kind of my point, really. It's just not affordable, especially if you want to go outside of Portsmouth as well, which is what the whole point of the car is actually for. So yeah, it definitely should be open to a more wider discussion.
I completely agree with you on those points, and I'd certainly agree with you about wood-burning stoves. That's a very kind of middle-class thing, and lots of people in my circles who installed them 20 years ago are not using them anymore. And you make a responsible decision about that, and there it is. But the point I want to make is that it would be really good if, when you sent out this strategy, you also sent out the hyperlinks to the very recently published public transport strategy that has been done, which does, as it states in this strategy, key in, and in fact I think there's a page that mentions the overlap between the two strategies. They do hang together, and the...
sorry, 2.9.
Yes, thank you. They do hang together, and a little... what we should be able to do is a little hyperlink diagram that shows the linkage between all the strategies we've got, because you know, that means that people can refer directly to the ones that are relevant, and certainly Councillor Candlish's public transport policy is relevant, and I think his policy, which is very much to increase bus use, and we've had recent grants from the central government to help with the bus infrastructure, but it would really help to link those up. 2 hyperlinks rather than, well, maybe 5 hyperlinks, because biodiversity and pedestrianisation and cycling are all there. I'm not advocating that wholeheartedly, because I think it's not fast enough. It should go further and faster. And we have to confront people who want to drive their cars everywhere. Frankly, with the cost of parking, which you haven't factored in, then...
Well, I live in the north of the city, we don't have parking permits. So
well, the point is, well, you should campaign for them, because they're good, I think. I was against them.
I don't know if there's going to be more money.
I was against them to start with, but
yeah.
they do work to stop people parking cars long term. The number of vans in my street before the parking permit...
I think there is also an argument, sorry to interject,
but I just wanted to say that, yes, I agree with you.
I think with the parking permit, there's definitely, you know, where I am in, you know, northwest of the city, which has a lot of impoverished areas, parking permit would be an extra burden. It'd make it even harder then if you just say they did have a £500 car and that was the only way they could get around for them, and then suddenly you're whacking on permits as well. So I understand what you're saying, but at the same time, it's like you've got.
They don't work like that. Is the point? I thought that.
Well, I mean, I think in certain areas they would. Don't get me wrong. I think some people just have 1 or 2 cars, you know, and be it for, you know, a full-time job or minimum wage. So I just think, you know, we should be very cautious about that, and you know, rushing to put parking permits in the whole city.
I'm not doing that. I don't have that power, nor do you. But I was dead against having them in my area, and we did campaign against it at the time. Most residents who you speak to now are very happy with it, because it removes people from leaving old vehicles in the car, the street that never move. And if you come down my street now, where it used to be full, in retrospect, of people's cars that they weren't using, just sat there, very, very bad. We now have spaces nearly all the time. Quite miraculous.
Thank you, colleagues. That was interesting. Thank you. I know that Dan has been waiting with anticipation to speak, so I'll hand over to him.
Thank you, Councillor Barrett. Councillor Simpson, in terms of the postcodes, I've found the relevant page of the report, which I'm very happy to send to you. We'll do so after this meeting. We've got PO1 13%, PO2 17%, PO3 9%, PO4 admittedly 29%, the highest of the bunch, PO5 16%, and PO6 12%. So there's a pretty good spread across the city with a little bit of a preponderance in Milton, Eastney and Southsea.
So why do you think that is? I'm just really curious because it's quite significant. It's like double, isn't it?
I could only speculate that there may be a little bit more awareness about this as an issue. There may be areas of the city where the link between air pollution and health is less well known, and that's something obviously in terms of the work that we want to do, that we want to ensure that everyone is aware, particularly those who are the most vulnerable, and often those who are most vulnerable are living in the more deprived parts of the city. So it's definitely something that we want to try and change and register it in people's consciousness so that they can make choices for themselves. And in terms of smoke control areas, I absolutely take your points about this potentially being a problem that is generated by middle-class ownership of wood-burning stoves and the like. There is a consultation ongoing at the moment, national government consultation on smoke control areas, and the proposals are for stricter emission limits for new stoves, mandatory labelling, providing clear information on emissions, increased enforcement penalties potentially, and measures aiming to cut harmful emissions, support cleaner technologies, and give households better information about health impacts of burning solid fuels. And our awareness and behaviour change strategic action on wood burning would very much take its cue from what the national government advice will be following that consultation, but it would tend towards providing people with advice. We know in other areas there are alert systems for people who have wood burning stoves. They can sign up to those, and then if we can see that air pollution is particularly bad in the city on a particular day, we could send out an alert saying, could you consider maybe not burning your wood burning stove today, because that will only add to the pollution in the city. So that's an option potentially down the line in terms of how we handle that those emissions into the city. I think that was everything. Thank you.
Thank you very much. Colleagues, any further comments or questions at all at the moment? No? No, well, I really appreciate everyone's feedback today, and Councillor Smythe as well. Thank you so much for the feedback you provided in the meeting we had beforehand. It was really helpful, and I'm pleased to see that we've added some of those bits to this report that has now gone forward. I take on board everything everyone said, but I am also very happy to note the report and send it to Cabinet to hopefully approve for the next, oh my God, my maths, hold on, 14 years, there we go. So thank you very much, colleagues, happy to send this on, and thank you very much for your time today. Thank you, everyone.